So what would you say, Lindsey, are the most important things to think about as far as what are the credentialing and the questions to ask? If someone is going to go across the ocean for a surgery, or even if you're talking about you're going to stay local, you're going to stay domestic, and you're going to stay in the country, what are the most important credentials to ask for if someone's looking for the most safe and successful hair restoration that they can have?
I think a very easy, very basic question that should be answered is who is doing your procedure and who is doing what part of your procedure. So I think on our end, you see a board certified plastic surgeon to start, and then we see you in the morning. Dr. Houssock, you're here all day. You don't go anywhere, and you're in the room and you're doing the design, the site work, you're making all the plans and the layout. I'm a certified nurse practitioner, so I'm doing the harvesting part. But if it's if it's a strip surgery, you've got a certified plastic surgeon doing that. So it's just one of those things, like that's an important component that I think people don't think about. We don't have a technician who has no medical background doing a surgery portion of the procedure.
And this might come as a shock to people who are hearing this. They might think, what are you talking about? Of course, I'm going to have a doctor doing my surgery. This gets really kind of shocking even for us. But here's the absolute reality, even in the United States. Technically, legally speaking, you do not have to be a board certified surgeon to operate. It's hard to stomach that statement, but it's just the truth that the state licensing companies do not necessarily follow you when you are a doctor as to what you're doing, and it's not technically illegal to perform an operation if you are not a certified surgeon, a board certified or board trained surgeon. So that is something that you really have to think about. And hair restoration, even in the United States, is not performed only by surgeons. There are legal places that exist in the country where a family practitioner who has 3 years of primary care residency training is performing your hair transplant. There are places where dermatologists, and you might argue dermatology has a little bit of a head up of others because they do train in skin and hair, and they do Mohs procedures. And so you could argue they may have some residency training in that surgical kind of training. But it's not illegal for any medical doctor to be the head in charge of your hair transplant. So I'd argue that not only do you have to find out who's doing it, and if they say that there's going to be a physician in the team, but also what kind of physician are they? Are they surgeons? Have they done surgery before? In other countries, unfortunately, in the black market, we are now finding that you very well may never see even a doctor at all. You couldn't imagine it, so you probably don't ask it, but it's very possible that when you go to a fancy schmancy, they pick you up in a limo, they put you in a hotel, and then you end up in this OR the next morning in another country, you may never, ever actually be seeing a doctor, a medical doctor. So you have to ask that question everywhere. Who is it, and what exactly is their training? Second, it does take a village to do a hair transplant. So it isn't just a surgeon doing everything in the day. There's too much to do. We are a team of 5, and the next question you should ask is, how often are you doing it? Our team is a team of 5. We're performing at least 2 operations a week. We only do 1 operation at a time, so we are on your head and only your head. Our team in particular includes a board certified plastic surgeon, my nurse practitioner. Lindsey has now been in the practice for over 6 years, and she has trained in hair restoration for that time period. So I urge you to find a more certified nurse practitioner who has been around hair restoration like Lindsey has. We have 2 to 3 surgical technicians with us who have been in hair restoration for over 20, 25 years. They know what they're doing, and they're ours. People ask that all the time. We don't outsource anyone. They are ours. They are employees of our practice, and they're very good. But that being said, the surgical technicians are not performing the surgery. The surgical technicians are assisting Lindsey and I. They are also under the microscope looking at the grafts that we're harvesting to make sure that they're in the perfect condition. They're also helping us, and they do place the hairs in our physical sites that I've created, but they are not performing your surgical operation. And that is also extremely important. We're very passionate about this because we care so much about your safety that, yes, we want you to come here to us, but we also want to set you up with the tools of who and what to ask when you are going to a consultation. What other things should people be asking about their particular, the place they're going, Lindsey? What other questions would be smart to ask if they're seeing somebody for hair?
I think the other question that I think of right off the top is, where is it being performed? What
Yes.
kind of a room am I in?
Yes.
We're a certified surgical center, and so we have a procedure room that we do our hair restoration in, and it is cleaned the same way as our operating room is cleaned. We have our surgical tech that does our turn down on our OR is the same surgical tech that turns down our hair room. And I think that's really important because in between patients, I want to know that room is as clean as an OR is.
Yeah, absolutely. So hair restoration can be done in a procedure room legally. And what you'll find is that if you have a board certified surgeon doing your hair restoration, chances are you're going to be set up in a certified surgical center. So we have that Quad A certification because we have our own surgery center. It doesn't have to be done there, but I would say another red flag would be if they're not doing it in that, because if you are a certified surgical center, they don't just let anyone operate in their surgical center. They can't legally. You need to be a certified surgeon. They want to see your credentials. They want to see your training. They want to see your board certification. And so you can't get board certification for your surgery center if you are not board certified. So, here's the thing. Could I do you in my treatment rooms where Lindsey does our injections? Yeah, technically you could do a hair restoration surgery in that room. However, I have a setup that is just optimized for your success and your safety in an operating room. So I do them in an operating room. If someone is a family physician or a person who is not certified in surgery, they will not have the option to do you in a surgery center. So a really important question to ask. In the end, you have to think about safety. Yes, we want good results, and results are as important of course, as your safety. But in some ways, you really have to just not ignore the fact that it's not all about results.